Hi, I'm Simon Yang, and I'm a 2021 graduate of the University of Minnesota Medical School. And I'll be beginning my residency in anesthesiology at the University of Minnesota this coming summer. Today, we're talking with Bobbi Xaiyavongson, who's a member of the API, Asian Pacific Islanders Women's Health Coalition. It is a coalition led by the Lao Center of Minnesota and funded through the Minnesota Department of Health Eliminating Health Disparities grant. We are going to be talking about the work of the coalition and how providers can work with their patients from Southeast Asian communities to provide the best care as part of the Twin Cities Medical Society's Community Conversation Series. So please welcome Bobbi.
Hi, Simon. Thank you for having me today. And congratulations on getting
Thank
your
you.
I am Bobbi, and I am with the Lao Center of Minnesota, and I am actually a housing program manager, but I do help out with the API Women's Health Coalition program and just providing that extra support to our program manager.
Great. So we'll just dive right in. Can you please tell me more about the Asian Pacific Islanders Women's Health Coalition, and how did you get involved, and why is it important to you?
The Women's Health Coalition is a coalition where we partner up with our fellow API organizations to try to reach out to our community members, specifically women, Southeast Asian women, and regarding breast and cervical cancer and just the general women's health overall. And because various studies and database shows that there has been a very high incidence and mortality rates in our API community for both breast and cervical cancer comparing to other race and other ethnic groups. So the whole purpose of this program is to raise awareness and provide education and how to prevent and lower the risk of getting breast and cervical cancer and around, again, general health for women. And we just try to encourage women to get screened regularly as recommended by their healthcare provider. And we want to make a better impact to our community and just to provide that extra support and services to those who can't access healthcare and don't know where to start when they're seeking for care.
Yeah. Can I quickly ask you, is there a reason why the rate is higher for Southeast Asian patients?
Yeah, from what we've learned throughout our program and from a lot of research, I guess there are a lot of barriers that women, that's stopping women from getting screened or getting checkup. And there are a lot of health perceptions around that as well in our community. And I can name a few, and one of them is, a lot of us were not raised in a healthcare system. So there's going to be that big gap between, trusting in the Western medicine and just the lack of health literacy, And another thing is traditional medicine. I know a lot of people, even till today in the States, a lot of people in our community still tend to, go for the traditional medicine just because it's quicker and easier access. And, for example, let's say if they were to go to the American doctor, they would probably tell them, to do something different or changing the way they live their lifestyle on a daily basis. So that could be one of them. And then another thing I want to point out would be the cultural belief. So a lot of people think not knowing the problem means they don't have to deal with it. So just to give you an example, let's say if a woman finds a lump, around their breast area or chest area, it could be a sign, that they're having like breast cancer or whatnot, but they wouldn't want to go like get checked up just because, they don't want to like have to deal with the result that's coming back later. Yeah.
Yeah. Yeah, those are great points. And I'm sure these barriers are something that, that any communities with difficulties with communications or are experiencing. I just wanted to ask you more about, the coalition. The coalition is made up of representatives from organizations that serve many of the Southeast Asian communities that live in the Twin Cities. I was wondering if you could share what the coalition has learned about the general perception of healthcare in the metro's Southeast Asian communities. I know we kind of briefly touched this topic, but would love to hear more about your thoughts.
Yeah, so I'm sure, since we partnered up with like 5 different organizations, I'm sure that each community have kind of like their own health perception, but overall, from what we've heard, it's those reasons that I mentioned previously, that has been, we have learned about that, and it has been like a big issue. In our community or our communities, the API community in general.
And we kind of talked about the barriers briefly, but have you found anything that has motivated women to get screened?
Yeah, so we have been, in the past, and we are still continuing to do so, is we have been organizing our own like mobile mammogram. So we partnered up with like a local clinic, and they would bring like a mobile mammogram van that could, have the ladies go up there and get screened instead of having them to go see a doctor at like a clinic or hospital. So that worked really well, and we are actually planning another one next week. Yeah, next Thursday. And also what we have been doing in the past is to like gather up a group of women to go to a hospital or a clinic to get screened for cervical cancer, which is, pap smear, because I think we found it really like, how it motivates people, because women just get more comfortable going, with a group of their friends, and have one of us be there with them just to kind of like, be the point of contact and, communication with the doctor, and just fill in any gap for them or between them and the doctor. So that worked out really well. And then another thing that we have been doing is just shows data and studies that shows facts, by providing different outreach methods, and just trying to teach the community about breast and cervical cancer education. And we have been doing it through person-to-person. Social media is a big part, especially during this time of COVID. And, a lot of people are using technology more often. And then printouts, we have done infographics, PowerPoint, and I think one of us even go on like the radio, the community radio, and just provide education through that kind of outreach. Yeah. And then financial help, I really do want to touch point on that, because as I mentioned, there are like a lot of different barriers, and financial concern is one of them. So there is a program that we work with. It's called SAGE program, where they jump in and help those with or without insurance to cover all like the cost. And what I really think is wonderful about this program is that they don't just cover for the screening cost, But let's say if a woman goes in and then, she finds out that she, is positive for like breast or cervical cancer and has to go through like the treatment process and things like that. So SAGE program will actually cover for those costs as well. So that's really great.
That's a very broad spectrum services, not only screening but also considering what would happen down the road, especially financially. That's a big help. I know that we talked about the mammogram service briefly, but what other services does the API Women's Health Coalition provide? Are there any other ones that, besides the one that we already talked about, that people can take advantage of?
Yeah. So the biggest issues that we have been seeing is the language barrier and like the lack of knowledge around healthcare in general. So those are one of the other things that we actually provide through our program, which is helping them with, let's say, for medical insurance or just translating materials or even just calling doctors to schedule an appointment. And one of the other biggest thing that we've seen would be helping out with like medical bills, because again, as I mentioned previously, the language barrier, sometimes it's hard for people. So that's one of the other services that we provide, is just to be that kind of like the middle messenger between, like healthcare companies and the clients.
Yeah, I think language is definitely such an important part of healthcare, and with access as well. So those are really important parts and services that are needed. So our conversation, this is going to be available for many physicians and medical students across Minnesota to view. I was wondering if you had any thoughts on what can physicians or students or healthcare professionals can do to support the cause and the work that you guys are doing.
Thank you for that question. So I would recommend, like the Western doctors, just to kind of like be patient with a lot of, the API community members, just because, from the reasons that I touch point on, and just kind of like be more open-minded and keep in mind that they are, we don't know a lot of, these stuff, and we're not very used to like the healthcare and how things work. So I would say just be more open-minded, be more patient, and kind of like go through, the process with us, because sometimes it's hard for people to, understand and just feel left out or different, and I would like to really point that out. And yeah, I guess that would be the biggest concern of mine.
Definitely. I think it's important that, we all have more patience and be more understanding and kind of work with everyone together. Are there any other thoughts or comments that I haven't asked you or didn't mention that you'd like to share?
I guess I've mentioned a lot of the issues. So I don't think I have anything else to add. Or one of the things I would, I think I forgot to mention would be kind of like the cultural difference, but I'm sure I, mentioned or touched base on that briefly, because I've noticed that how we were raised to be very private, especially when it comes to our health and personal issues. So, and that goes back to the questions that you asked previously about how we would recommend doctors or like practitioners to do, is just keeping that in mind as well.
Yeah, and I'm sure that's one of the barriers as well that we kind of previously talked about.
Yeah, yes.
Yeah. Well, thank you so much for your time today. It was a pleasure talking to you. And yeah, we'll be ending our conversation here. Thank you.
All right. Thank you, Simon.